A local group is working to stop the Ebola crisis in Sierra Leone, one of the hardest hit by the recent outbreak. Joining me is Dr. Sarah Page. She is the director and created the Ebola Survivor Corps. Dr. Page is also a postdoctoral scholar here at the UW, and she studies social sciences of infectious diseases. Dr. Page, thank you so much for joining us today. It's not in the news that much anymore. We thought that the numbers, especially, for example, in Liberia, quelled. Liberia, Sierra Leone, and Guinea. What's happening there?
So Liberia has experienced a burst last week in the number of cases and of confirmed cases. And Sierra Leone and Guinea have constantly had these little flare-ups, these micro-outbreaks across the nations in really hard-to-reach areas.
Now, it's fair to say Sierra Leone's been hit the hardest by this.
Absolutely.
Now, tell me about your group. Why did you found it? What does it do?
The Ebola Survivor Corps is designed to interrupt the spread of Ebola and to simultaneously boost the social status of survivors. Ebola survivors are often faced with stigma as they come back to their home communities.
We're looking at some pretty powerful images here.
That's some collaborators I work with in Uganda doing some infectious disease research. That's my son there in Uganda.
Oh my gosh, that's amazing. This is all in Uganda. Now tell me about the steps. You have specific steps, and we do have a graphic to show our viewers how and what your mission is once you get to areas, infected areas such as Sierra Leone.
So we target, hire and recruit Ebola survivors from the community, and then we have them complete Ebola response training, so they're first responders to any suspected cases, along with community health mobilization and training, so that not only are they responding to Ebola cases, but they're also looking to boost the overall public health resources in villages, and also to support transport for suspected cases from village to treatment facilities. And since Ebola survivors have been through the process of treatment, they can demystify what the experience of treatment is like for families of confirmed cases and sort of be a caseworker and a close form of social and emotional support for families.
That's pretty amazing when you hear it from somebody who survived it.
Yeah, really compelling.
And how are the communities? I mean, we see the pictures. They were in Uganda, but how are the communities receiving you?
We've been establishing partnerships with the Ministry of Health in a district called Kwanadugu, and they are really enthusiastic about our participation in their outreach programs and in redesigning some of the survivor work that's currently going on to be more of a jobs-based program.
If somebody wants to donate, what does the money go to specifically?
We have a target of $15,000, and all of that money will go directly to a community organization that's doing this work on the ground, the Ebola survivor work. And anything, we're striving to reach $20,000 so that we can send one of our team members back to Kwanadugu district to implement the project on the ground.
Well, they are so lucky to have you, and the fact that you care so much. Dr. Page, thank you so much.
Thank you very much for
your time and your efforts, too.
Thank you.
If you would like to help, please go to NBC15.com and click on News Links.